Hi, my name's Shazia Ali. I live in Newbury, and I was here representing the Muslim community. And that's an absolutely amazing event with a lot of information, very informative, and a lot of things that we can be passing on to our community to learn from.
Here today we have a number of leaflets about some of the services that we commission and work with. What you need to do is type in to Google or your search engine West Berkshire directory, and you should be able to search for a number of services ranging from information about diabetes, about adult social care, children's services, everything that's going on in the council. It's a one-stop shop which you may find useful.
Hello, my name's Jenny and I'm from Children's Therapies. So if you're experiencing some low mood or stress, or actually just feeling kind of overwhelmed with things at the moment, we're a service that might be able to help you.
Community services in Reading, Wokingham and West Berkshire. You can also join us on our volunteer service user rep team if you'd like to help shape local maternity services.
My name's Nazreen. I'm one of the maternity support workers at the Berkshire Hospital. But my role, along with a colleague called Berkshire, is a link worker's role. So we cover and try to help the women whose first language is not English. I also speak 3 other languages, which is Urdu, Punjabi and Hindi. So I also interpret for the maternity unit and make sure that women who are pregnant will be able to understand at their appointments what's going on and what stages. Because that wasn't really enough, for many years now we've been running an easy English class to help women learn about having their baby safely in pregnancy. Women who live in the Newbury area or in West Berks, we do cover in interpreting. So when the midwife is booking the appointment, when she is booking the pregnancy, when she is coming to the 28-week class, when they're coming to the 34, 36, all of those classes, me or one of my colleagues come to Lambourne or to Newbury to interpret for those women.
My name is Maureen Jack from SIAC Advocacy. As an advocate, I can help you to have your voice heard in decisions relating to your health and social care, and to help you better understand the support you can receive. The service is confidential and you will be supported by an advocate like myself, who is independent of all statutory services like the NHS or social care or the benefits office. Please call 0300 343 5731 to access an advocate. Thank you very much.
I'm Rashmi Shankar. I'm a clinical psychologist. I have, just by way of introduction so that you know a little bit about my work and context, I've served the people of Newbury for over 25 years. I'm based now around the corner in the grounds of the community hospital. And it's very good to be working with you today and sharing some information on the effects of stress on physical health. So I work in 3 languages. I provide cognitive behavior therapy in 3 languages, which is Hindi, English, Urdu. My work, certainly if anybody needs this service in West Berks locality, I would provide it at Healthwatch House. So the key messages are that each of us has different stressors and stressful life events. We can learn to recognize the signs of stress. If we do not attend to managing our stress, it will have a negative effect on physical health. There's more and more evidence coming up for that. We can learn to cope with our stress and train our body to relax. And that's what I'd like to invite you to do now in the about 2 or 3 minutes that we have. is to do a short exercise. Would you be up for that? To open your eyes and gently tune back in. Thank you very much for your attention and participation. Thank you.
What we'd like you to think about is what are the good things in West Berkshire in accessing health, social care, dental, this sort of thing. What do you think works really, really well? We'd like to hear what you think works really, really well. We'd also like to know, are there any challenges that you find in accessing health, social care, dental? And if something else crops up, write it down. There are no right, there are no wrong answers. If you like. So, 10 minutes.
So I meant to like do
Yes.
How are we all doing? All right?
What is good?
Yes,
What
yeah.
are the challenges? I think what we'll do, we'll go to each table and get one good thing and one challenge. Because that'll be fun, won't it?
Getting a GP appointment when you need it. Which
That's
is
one of the challenges.
No, that's a good. No challenges. Hospital care is really good and doing their best in difficult circumstances.
We actually felt that the GP service was actually very good at our table. So
They're trying to get an appointment.
the people on our table said they felt they did get appointments, and when they had a medical need that needed a lot of attention, they got a very good response. So
High five to all the GPs in the room.
yes. And a negative thing is that maybe communication needs to improve between services and users.
We echoed what Angus was saying. A great community hospital, it's very well respected and provides a great service.
Yeah.
In terms of challenges, access to services when English isn't your first language can sometimes be problematic.
Yes.
And that's.
I think access to service sometimes when English is your first language can sometimes be challenging.
So, signposting could improve for translation services and stuff like that.
Yeah, that's a very, very good point. Thank you.
What's good is there's lots of wonderful green spaces which are easily accessible for health and well-being. But there are challenges in terms of mental health resources. They're not always appropriate or easy to access for certain people. There are talking therapies and pills, but they're not always the right thing for everybody. And then there may not be translators. And sometimes people's backgrounds are not really considered. So sometimes people maybe look different or just have a different approach to things. And people make presumptions about what they need, or they don't understand that they do need help. They may seem that they have everything they need. They might have a big family, or they might not have a big family, but it's assumed that they do, and it's assumed that they have the support. So there can generally be a lack of empathy for some people find, and which leads to isolation, anxiety, depression that was spoken about previously. And then going on from that, there can be a lack of awareness, and people tend to go to their GP to find information, and then because the GP may not know everything that's out there.
So more sort of person-centric by the sounds of
That's right.
So we had some really good feedback about the Thatcham medical practice. Easy to get to see your GP, really good care, good callback service. It was all very positive.
Fantastic,
Nice.
that's what we'd like to hear.
So shout out to them. Some challenges, one was getting additional support at school, maybe for children with learning difficulties where in the family English isn't the first language and parents might not be able to access help or not know where to access help. So that was a challenge.
So that's something we need to pick up and get back to the relevant commissioners. Thank you very much.
Poor follow-up care after discharge, inconsistency, depending on which part of the country you're in, which
But when the Berkshire and GP surgeries is not consistent at all.
So it could be good, it could be less
It
good.
could be really good, or it could be, back and across.
And very interestingly, sometimes things appear to be absolutely brilliant for an awful lot of people, and then sometimes really far from brilliant.
Yeah, you say on the top, hard to get appointment, easy to get appointment, there's not consistency
Yeah,
throughout.
and I wonder whether instead of it being absolutely brilliant beyond all belief, maybe a more even service in the middle might be more popular, I don't know.
The last one is to do with, I've just written down prevention versus reaction. Patient information point at the community hospital is fine, it's staffed, it's womaned, it's got a lot of information there. The one in the surgery, it's got information but it's not staffed regularly. Maybe there's improvement needed there.
Fabulous.
Information availability so people can take greater care of their own health.
Wonderful. Thank you very much.
And so one thing that we all generally found was that the reminders for appointments has improved.
That's good.
You know, good communication before the appointment. If there's any problems, they'll inform you, get cancelled. The downside to that is as we move more and more to digital recognition that, you know, perhaps the older generation don't have access to mobile phones or emails and therefore need to consider their needs as we transition through that digital phase.
Yes, I mean, it's something which will change over time, but there are people who just cannot use it and everybody assumes you can use it. And if you call 111, the first thing they tell you is to look at 111 online and they'll text you the app, which is fine if you're tech savvy, but if you're 90, it's not necessarily the first thing you want to hear. But you know, we do need to think about who's using the service and if it's fit for purpose and solving problems.
Age has nothing to do with it. There are people in other age groups also who will say that they have the same issue.
That's true. Thank you very much. Karen?
We think that in West Berkshire we've got an amazing third sector.
Yes.
And our concern was around the ambulance prioritisation, in as much as if you ring for an ambulance, they tell you yes, great, they're coming, but actually then it may not be a realistic, they don't communicate a realistic time frame, so it can cause more anxiety because of the wait, whereas you need to be told it might be a bit longer.
So rather than not saying anything, better to actually say if it's going to be 45 minutes or something to tell people. That's a very good point. Thank you. Right, thank you all for that. We've now got the fabulous Dr. Deepak Ravindran.
Right, everybody relaxed, or you want to shake a leg? You okay to sit for another 10-15 minutes? Happy with that plan. Okay, don't want you to be in too much pain. Okay, so I'm the lead consultant for the Department of Pain Medicine at Royal Berkshire Hospital, and I also help with the Community Integrated Pain and Spinal Service. I'm here to tell you that all pain is fundamentally real. It is not in your head in that sense that the healthcare professionals may have told you. But there is a way of looking at it which is different. Here, if I can leave you in the next 10-15 minutes, is to understand that there are so many wonderful and holistic ways to look at pain management than just focusing on the next surgery or the next fix, which is natural. All humans have hope. You want to be completely pain-free. There's the understanding that we can do a lot more, as somebody spoke about prevention. Prevention probably is equally important, understanding what to do rather than reacting to it and trying to solve it after it's happened.
We want to basically increase the number of years that patients are living with cancer. So there are some ethnic minorities that don't believe in screening because what's that? Don't have that back in my country, so why would I think about doing it here? Culturally, there were, I did a talk at the Pakistani community event recently, and the ladies there didn't actually know what a smear was. It wasn't something that was talked about. You generally don't talk about your intimate areas, and therefore if you don't talk about your intimate areas, then you're not aware of things like a smear, how often you should have it, and the beliefs like, well, I'm married, do I really need a smear? I don't really talk about breasts, so why would I be examining them? How do you examine them? And if the letter comes in the post and it's written in English and it says, you are now due your mammogram, if you don't read English, you won't be able to do that. I mean, if you think, I'm cancer lead, and my dad said to me, I've got this letter in the post, I don't understand what it means. And it was his poo in the post letter. And he speaks English, and he's worked here for 40 years, but the actual leaflet that came, and him looking at it, was so kind of, oh, this is really daunting. I mean, how am I going to get some poo and smear it on this card? And to actually read that, and then have either someone that you're willing to say that to. I mean, it's the kind of thing you just read and chuck in the bin, isn't it? And I'm sure all the GPs that are here will say they will have come across people that have got fungating breast tumours or vulval tumours where they just haven't felt comfortable enough to kind of say anything, and so they've just ignored it, covered it up, and hoped it would go away, and it hasn't. It's just got worse, and then they've got cancer. So it's actually really breaking those barriers down to the community to say, you can talk about these things. These things are worrying things, and you should be approaching your GP if you have them. These are the national screening programmes. You should be doing them. Just making them socially acceptable in those groups in a way they find acceptable. So we had women's only talks for our Pakistani ladies because that was more comfortable for them. But then we had the Polish church group, which actually had one of the consultants come to the church group and talk about a type of specialty that the actual people said they wanted more information on. And then we got about 25 cancer champions trained, and then the next phase of the group was we asked each cancer champion to link up with the patient participation group of the local practice. Not necessarily the practice that you're joined to, but just where you live and just pairing them. And the purpose of that was to say, we want a community revolution. We want health to become a focus that people themselves have, rather than just NHS England, commissioners, GPs. We want you guys to become involved in healthcare and how you can make your communities engaged and involved in healthcare.
And I love the community-led revolution idea. It's one of the things we absolutely just have to do. Your health, you're a big player in it. It's not just down to the professionals anymore. I'm going to hand over to Kamal Bahia, who's PPE lead.
PPE stands for Patient and Public Engagement, and we sit underneath the Health and Wellbeing Board. And I've been a practice manager for 12 years in this area, and I'm passionate about trying to hear what people need, want, how we can represent them, and how we can make sure that we're feeding back their experiences into making services better.
Now isn't the time to go through an NHS England 90-page document. The long-term plan is about keeping the NHS viable, sustainable. Not here to be pessimistic, but the rate of increase in healthcare demand is globally an issue. We are very fortunate to be in the only country with a free at point of service health service, and so matching those two principles is really important. The long-term plan attempts to set out how that can be possible. 4 key tranches. One that isn't particularly new, but it's emphasised again, is care closer to home, out of the hospital setting, more preventive, more proactive, and making sure that care is personalised. Again, exactly as we've heard today, really important to make sure that it is what that individual, in the setting of their background, their family, their friends, their culture, that it's the right treatment for them in the right place for them. I think we saw that striking slide of Deepak's that you treat each individual illness, you win some, you lose some. But if you treat the whole person, then you're basically operating in the right field. You're always going to win. That's always going to be the right thing if you treat the person as a person, as a whole person. So that's one key part of it. Tackling inequalities is another huge part of it. We've heard of that today. Not just cultural and linguistic challenges, but actually the inequalities between certain types of problem. Why should mental health, a patient with a severe mental illness die 15, 20 years earlier than people without that diagnosis? So tackling inequalities is a huge part of the NHS long-term plan.
My name is Varun and I am representing Newbury Malayali Cultural Association in Newbury. We are basically a group of people who come from the southern part of India called Kerala. And so we are running an organization of a community for the last 9 years in Newbury.
Hi, I'm Kate and I work for a charity called Time to Talk. Now, if you are a parent and you're worried about your child, the child is struggling at school, struggling with high levels of anxiety, or there's something going on that you're not quite sure, but they're worrying, their behaviour has changed in any way, then it really is a good idea to perhaps get them to a counselling service where they can talk to someone in confidence and actually work through those anxieties and fears. We actually go up to the age of 25, so it might be that it's actually yourself that's worrying and struggling with anxiety or any number of issues that may well be bothering you in your life. We are a self-referral, so you don't have to go to your GP. You can come straight to us.
If you know anybody who's interested or maybe a little bit shy, not too sure about, going to GP, probably see us.
Hi, my name is Hadija. I work as a community engagement worker for Berkshire Women in Aid to stop violence against women and girls. We support women who has been suffering from any kind of abuse, such as forced marriage, FGM, honor-based, online abuse, and we go to refugee home for men and women. If you know anyone who need our help, to contact the number from our online. Thank you very much.
I've learned a lot, and hopefully can pass this message on to members of our community to help them understand certain health issues, and there was very, very informative, absolutely amazing speakers, amazing food, and hopefully this will help our communities all working together a bit more as well.
But people come from our place don't have a clear idea of what's happening in the community and what all services are available in this country or in this community. So this gives a better awareness to what we can do and how we can explore things and whatever information we need.
Hi, I live in Newbury and I heard about an event from Facebook page called Community Matters, and I found it interesting, get a lot of information today, and very useful, and I hope they'll make it again.
Hi, I'm Richard Littledale, the Minister of Newbury Baptist Church, and really pleased to be here today at this event. To me, community is absolutely vital. I'm very involved in the community, and today's event is all about connecting across communities.
Hi, my name's Steve Masters. I'm one of the West Berkshire District Councillors. We had some great speakers discussing issues such as mental health, pain management and cancer treatments, and how we reach into ethnic minority and refugee communities across West Berkshire. And I think from a personal point of view, I find it extremely interesting reaching out to the communities themselves, which are often hard to connect with, and I think we've opened a few doors and given a little bit of a showcase on what mental health, physical health provision there is available across West Berkshire.
I just want to thank all our amazing speakers today. I think I vaguely know what's going on, and we've learned so much, I think, today. And I think the really important thing, this is the day of the great get-together, the hashtag is more in common, and I think we basically have, and one of the things we've got to try and encourage is to do more things like this, where people can find out how things work differently, with different people. Everybody has the same challenges coming at them at different times, and I'm really, really proud of everybody who's involved in here. The cast of people who've put this together is incredible.
And my biggest thanks are to Alice, wherever she is sitting. I can't see her at the moment because she is absolutely the driving force behind this, and we wouldn't be sitting here, Alice, if you hadn't put a huge amount of effort into getting us all to do what we needed to do. So a really, really big thank you to you.